Hi, welcome to my channel. Subscribe or dale like if you like. Today we are going to explain the drug Atarax. We will talk about its mechanism of action, its adverse effects, its doses and its therapeutic indications. What is Atarax and what is it for? Atarax is a first-generation histamine H1 receptor antagonist of the diphenylmethane and piperazine classes that has sedative, anxiolytic, and antiemetic properties. It was first developed in 1955, and has since remained a relatively common treatment for allergic conditions such as itching, hives, dermatosis and histamine-mediated pruritus. The active metabolite of Atarax, cetirizine, is also available as an active ingredient in allergy medications, and is responsible for much of the antihistamine effect of Atarax hydroxyzine. Mechanism of action of Atarax. Its action may be due to a suppression of activity in certain regions of the subcortical area of the CNS. It has anxiolytic, antiemetic, antihistamine and bronchodilator activity, antispasmodic and sympathicolytic effects. Therapeutic indications of Atarax. Symptomatic treatment of anxiety in adults. Symptomatic treatment of pruritus and hives. Pre-medication before anesthesia in adults and children, over 6 years for solid oral forms, over 30 months for liquid oral forms. Posology of Atarax. Oral. Adults. Symptomatic treatment of anxiety, 50 to 100 mg/day in 3 doses of 12.5 to 25 mg, 12.5 to 25 mg, 25 to 50 mg. Symptomatic treatment of pruritus and hives, 25 mg at night, increase 25 mg/3 times/day, if necessary. Pre-medication before anesthesia, 50 to 100 mg/day in 1 or 2 doses. Maximum dose for adults, 100 mg/day. Children from 12 months. Symptomatic treatment of pruritus and hives, 1 mg/kg day to 2 mg/kg day distributed in several intakes. In children up to 40 kg of weight, the maximum daily dose is 2 mg/kg day. Pre-medication before anesthesia, single dose of 0.6 mg/kg 1 hour before the operation, which may be preceded by 0.6 mg/kg the night before the anesthesia. Cumulative dose in 24 hours, should not exceed 2 mg/kg day. Maximum dose in children 2 mg/kg day in children up to 40 kg. Liver failure reduced daily dose by 33%. Moderate or severe renal insufficiency reduced dose. Contraindications of Atarax. Hypersensitivity to hydroxyzine, cetirizine, other piperazine derivatives, aminophylline norethylene diamine. Porphyria. Pregnancy and lactation. Prolonged congenital or acquired QT interval. With known risk factors predisposing to QT interval prolongation including pre-existing cardiovascular disease, electrolyte balance disorders, hypokalemia, hypomagnesemia, family history of sudden cardiac death, significant bradycardia and concomitant use of substances with recognized potential to produce QT interval prolongation in or induced or SAID de Pointe. Warnings and precautions of Atarax. Moderate or severe renal failure. Liver failure, elderly, not recommended, glaucoma, bladder flow obstruction, decreased gastrointestinal motility, myasthenia gravis or dementia. With increased risk of seizures, especially in children, risk of prolonged QT interval, if signs or symptoms appear that may be associated with cardiac arrhythmia, discontinue treatment. Liver failure with Atarax. Caution. It is recommended to reduce the dose. Renal failure with Atarax. Caution in moderate or severe renal failure. It is recommended to reduce the dose, decreases the excretion of the metabolite cetirizine. Interactions with Atarax. Increase risk of cardiac arrhythmia with, substance known to prolong QT interval and or induced or SAID de Pointe, such as antiarrhythmic class IA, for example quinidine, disopyramide, and class 3, for example amiodarone, sotalol, some antihistamines, some antipsychotics, for example haloperidol, some antidepressants, for example citalopram, escitalopram, some anti-malarial drugs, e.g., mefloquine and hydroxychloroquine, some antibiotics, e.g., erythromycin, levofloxacin, moxifloxacin, some antifungal agents, e.g., pentamidine, some gastrointestinal agents, e.g., prucalopride, some agents used for cancer, e.g., doramafene, vandetanib, or methadone. This association is contraindicated for effects enhanced by alcohol. Plasma concentration increased by cimetidine. Avoid simultaneous administration with MAOIs. Counteracts the pressurizing action of adrenaline. Antagonizes the effects of beta-histidine and anticholinesterase drugs. Caution when administered with other substances capable of producing hypokalemia and/or bradycardia. Interferes with the results of allergy test or methacholine bronchial provocation test. Pregnancy and Atarax. Contraindicated. Lactation and Atarax. It is contraindicated during lactation. If hydroxyzine therapy is necessary, breastfeeding should be suspended. Effects on the ability to conduct hydroxyzine. Atarax, hydroxyzine, depending on the dose and individual sensitivity, may decrease attention, alter reaction capacity and produce drowsiness, amnesia or sedation, especially at the beginning of treatment or after an increase in the dose. Driving vehicles or operating machinery that requires special attention or concentration is not recommended until it is proven that the ability to perform these activities is not affected. Adverse reactions and side effects of Atarax. Drowsiness, headache, fatigue, dry mouth, sedation.